So welcome everyone to SHENLA and the Lethbridge Public Library's second Community Conversations speaker series on social housing. My name is Caroline Moynihan and I'm one of the adult service librarians. Before we begin, I'd like to start with a land acknowledgement. The Lethbridge Public Library acknowledges that we are gathered on the lands of the Blackfoot people of the Canadian Plains and pays respect to the Blackfoot people past, present, and future, while recognizing and respecting their cultural heritage, beliefs, and relationship to the land. The city of Lethbridge is also home to the Métis Nation of Alberta Region 3. I'd also like to sort of offer what SHENLA, a background on SHENLA, so people can have a little bit more information on the organization. And I'll put it in the chat, so if people want to read through it or get the email to contact Sharon at the end, they can find it there. So SHENLA began as a result of community consultation and the development of the City of Lethbridge's community well-being and safety strategy committees, where they were reorganized and previous anti-poverty work was shifted to community-led initiatives with support from the city. As a result of a variety of community organizations, they came together to discuss how best to continue to address social and health inequities in Lethbridge and area. Initial conversations in 2019 brought together a group of key stakeholders who worked together to form the basis of what is now SHENLA, the Social Health Equity Network of Lethbridge and Area. The mission of the group is engaged individuals, groups, agencies, and sectors joined in collaborative action for social equity and well-being of Lethbridge and Area, working together in an evidence-based way, collective impact to move the needle on complex social issues. So SHENLA has four main objectives that they are currently working on. The first is to build capacity and collective action in order to promote equal health and well-being of all people in Lethbridge and area. The second is to obtain and share data and evidence of injustices regarding health policies, programs, and practice. And the third is to advocate for public policy that reduces health discrimination in Lethbridge and area. And finally, the fourth is to improve the effectiveness of collective efforts to reduce these injustices. So anybody that has any interest in it or wants to become involved and wants to join some of the general meetings, the contact is Sharon Nikki, and I'll put her email in the chat along with this information so you can contact her. So now we have each of our panelists that are going to introduce themselves and speak to the work that they're doing in Lethbridge. If you have any questions, just put them in the chat or in the question section below, and then we will answer those questions at the end after each has gone. So whoever wants to go first can just jump in.
Perfect, I can jump in. My name is Kale Hayes. I manage the River House program here in Lethbridge. River House is a permanent supportive housing program. We've been operating since August of 2015. Our overall goal, we were looking to provide housing and 24/7 supports to chronically homeless, substance-using men. When we were initially starting, there was an environmental scan, and what came from that scan is that there was a particular population that was quite hard to serve at that time, based on who we were seeing not being supported through outreach or typical market housing style programs. What that group was particularly aging men with chronic addictions, mental health, and physical health issues coming together concurrently. So River House has been going. We're one of the smaller facilities now. We're really excited to see some new permanent supportive housing groups jump on board. We use the managed alcohol program as one of our key strategies, which originally created some pushback because we're going, what are we doing, taking this population and providing them with alcohol at stage doses. But what we recognized was that in doing so, we were able to bring a population that was really hard to serve and introduce them to supports that they would otherwise be foregoing. So we have an interdisciplinary team made up of a nurse, social worker, addictions counselors, etc., that are able to work with this population on while also bridging to community connections. Prior to the inception of our program, these individuals didn't have somewhere to necessarily go, particularly because of their active substance use. So what would be happening was there'd be situations where individuals would not be accessing medical care because they weren't able to access stable housing, and end up in the ER with complications from something as simple as diabetes, right? So we were able to design a program where individuals could live. We can work with them on their addictions related goals, but also serve their overall well-being in such a way that's comfortable and safe. We've seen some great outcomes from it thus far. One of the biggest outcomes was a huge reduction in the use of the inappropriate use of those public systems. So we've seen individuals who went from hundreds of hours of police interactions down to a few hours a year of any type of interaction. So definitely saw some success with our rather small population, and definitely excited to see that kind of scaling up in our community. So that's us.
Oh, I think you just need to unmute yourself.
Okay, sorry. So I can go next. So I am Sharon Brown. I'm the program director at SASHA, and particularly for our VERSA program that we've just started. So SASHA has been around. It's Southern Alberta Self-Help Association is what SASHA stands for. And we've been around since 1978 and providing supports in the community for individuals with chronic and severe mental illness. So a lot of our folks experience pretty severe symptoms of schizophrenia or bipolar or borderline personality disorder are the main kind of diagnoses that we see in our SASHA residential program. So we have highly, skilled and trained staff that are able to support the folks that we have in our residential program with with medical, psychiatric supports, with activities of daily living, with all of the things that will help them kind of live the most successful life that they can. And we really look to help those folks develop skills for independence, problem solving, critical thinking skills, all of those kind of things. So we had an opportunity to expand our program to work with people that needed permanent supportive housing. So expanding that program with for mental health supports to reach the population that would be kind of a similar population that River House supports, so individuals who experience those mental health concerns, but that are also struggling with homelessness and that have not been housed. So we're really excited. We're really new to permanent supportive housing. So we've only had a couple months of having our program up and running, but even already we can see quite such a difference in the ability to act. Like Kale was saying, we have seen already a reduction in accessing emergency services. We've already seen individuals who were actively using drugs or alcohol, and who, although we're there to support from where they're at, they're just voluntarily reducing their use. And they're like a lot of the people that we support are already just in a completely different kind of headspace than they were just even a couple months ago. So we're really excited to already be seeing such a great response from those people that we were supporting, and excited to keep going forward with it. And that's all from me.
Hi, everyone. My name is Kayla Moon. I am the Director of Community Alliances at Lethbridge Housing Authority. So Lethbridge Housing Authority is one of two management bodies, housing management bodies in Lethbridge. The other one would be Green Acres Foundation. And so what Lethbridge Housing provides is we have housing and we have housing subsidies to help people stay housed. All of our options are independent living. So unlike the permanent supportive housing that Family Ties and SASHA offer, we are at kind of a different stage at the housing continuum. So we have 403 housing units for couples and singles, mainly seniors, along with 275 units of family housing. The way that those programs work is the rent is set based on what the province deems to be affordable. So it's 30% of the household's gross monthly income. We also have about 120 units of affordable housing, so housing that would be considered affordable to the market, which is 90% of what the rent of the market unit comparable would be. And then we're going to be building 64 units of seniors affordable housing in an effort to hopefully repurpose one of our high rises to be social housing for singles under the age of 50 so that we can expand what housing options we have. We also have nearly $3 million in rent subsidies, so to help offset some of that higher private market rental cost for some of the people who are on lower income. Through all of these programs, we serve approximately 2,500 Albertans every year with housing affordability needs. We also provide some supports to some of our tenants in there. So we have some social workers and some mental health supports for people who are in housing, understanding that housing is more than just the bricks and mortar of the building that surrounds them, but that the supports that are in place are just as important and just as required to kind of help people stay housed regardless of what they're going through. And that covers the vast majority of what Lethbridge Housing does.
Awesome. So you guys covered like a wide range of what's, what is happening in Lethbridge and different organizations are doing. So if anybody has any other questions, just type them in the question and answer, and then whomever wants to answer from the group will answer them. I did have one to start with. Can maybe you explain the difference between social and affordable housing, or what similarities they are? Anybody? Yeah.
Yeah, absolutely. So the difference between social and affordable housing is social is more of that deep subsidy housing for people who are on really low or very fixed incomes. And that's where we're looking at that 30% of the gross household income. So for people who are on income support or on ASH, on pensions, things that are very low, very fixed, that's what the social housing looks to support. Affordable housing would be considered what is affordable to the market. So if you're looking at a 1-bedroom, that's $1,000. Affordable would be no more than 90% of that. So you'd be looking at a $900 a month 1-bedroom rental versus that $1,000. The Lethbridge housing, the way that we offer affordable, is even a little bit cheaper than that, just because sometimes that's still not affordable to people who are on a fixed income, but that's what those definitions are covering.
Perfect. Another one was if you could sort of anybody could speak to sort of the need that Lethbridge is seeing, or what trends we're seeing in the community, just so people have, there's always this, notion that, there's a lot of invisible need for housing and sort of, you don't see it as actively, I guess, in Lethbridge. So maybe if somebody could speak to sort of the needs that we see currently in Lethbridge.
So for Lethbridge housing, right now, we have a wait list of about 400. So there's 400 singles, families, people who are on our wait list right now who are looking to access supports. And that kind of just covers our program. I don't know if SASHA or if Sharon or Kale want to talk about kind of the wait for PSH.
For PSH, for our consortium, we are seeing, I don't know the exact numbers, but we have many, many people that are on our wait list that are, and we're almost full. We only have a couple of spots, and I think the YWCA is in the same position where they only have a couple spots left, and we've only started just, like I said, a couple months. So the need is, I don't really even know the extent of the need yet, but it seems like, we would be at capacity, and more than double capacity we would be able to support folks.
Another feature that we're seeing in some areas of BC, but out of Alberta is quite unique to Lethbridge, is the really high level of acuity that we're seeing in some of the participants who are coming into our community and in need of permanent supportive housing. Very rarely are we seeing someone present with one type of issue, whether that be strictly a developmental disability, strictly mental illness, strictly substance use disorders. We really are seeing quite a high level of these concurrent high acuity individuals coming through. Sharon might be able to attest to that as well, but as we're getting the referrals, even a few years ago, the referrals that were coming in were slightly different. Now, I would say the majority of the referrals that come our way have those comorbidities identified right off the hop. So it is a complex population that we're seeing, especially the users that are the longer term users of our shelter systems. Those individuals are individuals with complex needs kind of across the board. And they're also individuals that aren't fitting cleanly into one established system. So they don't fit well into services for disabilities because they also have mental health issues and addictions. They don't fit well into the hospital or health world because they have the other social problems going on. So I would absolutely say complexity is one of those things in Lethbridge that we're working really hard to navigate.
Yeah, I would definitely agree with that. And I think that that's kind of what our mandate is as well, is to take the highest acuity people first. So we are seeing people that have just a lot of, like, again, they don't fit into any system. That's why they've been in the homeless serving world for a long time.
Just somebody had a question to follow up from what you guys were talking about before. They want to know what your actual capacity numbers were.
Yeah, so for our program, we have 10 beds right now for PSH, and we have 25 in our the other residential program. So, and I think we have, well, we don't really even have space because we have 2 beds right now that aren't filled, but we have people ready for those beds.
And our project right now, we're quite low. So we have a 10-bedroom facility, and then we do support a couple others in the community who use that facility as a hub. I don't have the exact numbers for the YWCA, but theirs is the largest permanent supportive housing project at this time, and they have a split between men, women, and youth. So I can't speak to their capacity at this time. I know that they're larger than us. I know they more than double our size. So
yeah.
Somebody else was also wondering, how does this group work with Housing First through the city?
So this is always a complication because Housing First is a philosophy and a framework for serving individuals. And also our city sometimes uses it synonymously with the housing focused teams or the homeless serving teams funded through the city of Lethbridge. For our program, we do get a contract through the city, but it's provincial and federal funding flowed through the city. As far as Housing First goes, the philosophy is integrated into all the work that we absolutely do. What that means is we're taking individuals, we're placing them into housing and then dealing with the challenges, not expecting someone who's homeless to navigate systems prior to being given a house. So we're not saying, hey, you have mental illness, we need you to go connect with a psychiatrist or deal with your addictions. We're saying we'll put you in the facility and we'll put wraparound supports around you so you can navigate as you go through. I did see it pop up when they're talking about, I saw a question about home base in reference. So a home base was previously where everyone went kind of to get channeled in. CMHA is still using coordinated access. So when individuals enter our system, we're working towards having a by names list. So when an individual experiences homelessness, right away they're going to be triaged. So is it someone who's maybe just experiencing homelessness because of a situational aspect? Is someone fleeing abuse? Maybe they need a rent supplement or diversion services. That might go more to the Lethbridge Housing Authority. Do they need outreach support where they need someone to come into their home in the community and support them there? Fantastic. There's programs they can channel for that. Or they may be channeled into permanent supportive housing if it's recognized that they're unsuitable for less intensive housing arrangements like a market housing approach, or if right off the hop, their needs are so great that it's clear that they're not going to be able to maintain in a less intensive setting. I don't know if that answers that question.
So somebody else was wondering, given the previous news about, mustard seed and what happened with Armada and everything like that, and eventually, it didn't work and it fell through. They're just wondering, what can Lethbridge do to educate the people about why these supports are valuable?
For me, I think that it's important to recognize that a lot of times we look at things from a fairly narrow lens, whether that be economic or whether there's some fear or that NIMBYism is playing in. I come from a very conservative family, and when we started this program, actually she'll kill me for saying it, but my mom goes, wait, you're letting people live in this place and giving them wine? Sign me up, I want to move in, right? And it took even some education within my own family around the fact that there's a very real cost, even from an economic standpoint, of leaving individuals on the street. Before we even get into the humanistic side of it, saying, you know what, these are individuals, the cost to keep someone in shelter, the cost to keep someone in jail or in a hospital is actually quite great. The other argument that I look at around terms of that NIMBYism is having individuals connected and accountable to programs where they're thriving and doing well is actually a great way of improving the community landscape. So of our individuals, we've been doing it for 5 years, and a lot of them come to us with extensive criminal histories or extensive pieces. The most significant crime that we've had one of our individuals charged with was a traffic infraction. He had dementia, he was directing traffic. We haven't had any property crime, we haven't had any theft, we've had no assaults. And the individuals who came into the River House program, at first there was a community placement committee designed to ensure that we were taking the individual who was the highest need. So our organization didn't even pick our own clients that we worked with. So if you're able to take the individuals who have the most extensive histories and house them effectively, reducing things like property crime, reducing things like those random police interactions, even the seeking behaviors. So when you're on the street, and particularly if you're using substances, a large part of your time is geared towards finding a means of getting those substances and then taking them in a place that's quite vulnerable. So what I look at when we're looking at the NIMBYism place is, I understand the fear, I understand concern. Population need to be accountable, but if done well, it actually improves the community landscape, and I firmly believe that.
And to add to that too, I do believe it can be looked at almost like as a preventative medicine or a preventative. The people that we support are people that have maybe in the shelter or homeless because of mental health. So if we can help get people connected and get people in a place where they're able to, you know, have a psychiatrist and take a medication regularly, that is going to be a huge preventative to any sort of crime or anything that's going to be going on in the community. So I don't know how to actually, like, I think the question was, how can we educate other people? Because I think that is the question. How can we? Because it's obviously it's a great thing and it can make a huge difference. But yeah, we should try and educate a little bit more and let people know what's going on and the good that we can do.
And if I can come at it from just a slightly different perspective as well, one of the most important things, in my opinion, on housing in Lethbridge is we need to have a continuum that serves everybody, right? And so there needs to be options for everybody and what's going to be suitable and what's going to be appropriate for them. And so the continuum for housing will run for everywhere from people who are currently experiencing homelessness all the way up to market housing and home ownership. But there needs to be options in each of those categories that's going to be enough and is going to be suitable for the person that's looking. And if we're able to provide all of these things to our community, then we are going to see a reduction of all kinds of social problems and all kinds of these seeking behaviors that they were speaking about. And so mustard seed in particular is serving a different group that is currently underserved. We do not have a lot of housing options for single individuals who don't have any dependent children, who have maybe some higher needs, but not quite as complex as the ones that Kale was speaking about before. And it is becoming a big gap in our city. And if it's left unchecked, it could become a bigger social issue as things go on. So it is important that we're looking at all of these different options so that we can serve a true person-centered approach in Lethbridge.
Okay, somebody else was wondering, we are seeing this with the persons we serve. They are the executive director of the Lethbridge Pregnancy Care Center, and they're seeing women who are needing housing support for them and their newborns. Is there anywhere that is able to support moms with new babies and potential mental health?
So Lethbridge Housing offers family housing for moms with new babies. The unfortunate part is that there's a wait list for all of these programs, so we couldn't offer some kind of guaranteed housing option. However, it is something that we can look at. And so when you have these young moms, if you can submit applications to us, we'll have a look at those. We don't provide full kind of supports. It's very light touch supports that we're able to provide. However, if you have an outreach team or something like that that we can work with, we are always looking for partnerships. We are always looking to try to support the families that are living with us. Lethbridge Housing does mostly just provide housing. We do have light touch supports, but if there's teams that want to come in and work with us, we are happy to talk partnerships with all that kind of stuff.
And as well, I know Shannon's not here, but I know the YWCA is definitely a resource. And moms with young babies can definitely get supports through there.
Okay, somebody else was wondering, do you ever redirect your clients to other resources when you're full? What other resources can you offer or redirect them to?
Yeah, so we have a really good partnership with a lot of different community partners. So just depending on, it's really individual, really depends, but we have a good partnership with Alberta Health Services. So sometimes if someone just has some other outreach kind of supports, they can manage independent housing. So it just depends, but yeah, we have a lot of partnerships in the community. But there's some definite gaps as well. So sometimes someone will come to us and we would love to maybe offer them some supports, but there's not as much as there could be.
Connie wants to ask you, Kayla, can you share more information around the criteria for approval of rental subsidy programs?
Yeah, absolutely. So there are a few different rent subsidy programs. However, the easiest way to explain it is that the criteria is that they meet the low income threshold. So we are governed by the province on what that looks like. The low income threshold is based on the income thresholds that are set by the province. It varies depending on family size, but that is going to be the easiest way to kind of differentiate. So as long as they're under that amount, they can apply. Every application that we receive gets scored based on this exact same scoring rubric, and then they get essentially prioritized based on this rubric. It looks at things like how many dependents in the household, what the rent to income calculation would be, if there's any barriers in the household, if you're paying your utilities or if they're included, things like that. Once we have the application, we look at all of that stuff, and then we would make placements based on who is in the highest need. So when we say that we have a wait list of 400, that does not mean that someone who applies tomorrow is going to be waiting forever and ever. If they are the highest need, they are the person who is going to be helped first. The rent supplement program has been offline since November 2019. However, it was just announced that it has gone live, so we are accepting applications right now. The most important thing that we need is with the Lethbridge housing application, we need some kind of income verification. We need some verification of what your rent amount is, and then we're going to put it through our scoring process and make those placements. I can put my email information in the chat if anyone wants more specific information on what that looks like, and I'd be happy to discuss that with anybody.
Okay, we also had a question from Glynis. She wanted to know, when will the new senior housing be started with Lethbridge Housing?
So we have the land kind of earmarked and ready to go. So it's in the process of just trying to secure funding sources. We are hoping to have to break ground by the fall, but of course that's going to be dependent on funding sources and all of that kind of stuff. So it's announced, it's coming, and once we have more information, there will be a press release on what that looks like.
Okay, we have another question. It says, weird comparison and a bit of an extreme example, but Vienna implemented a thorough public housing program in the 1920s, and today over 60% of the population of that city lives in gorgeous community public housing regardless of economic status. Would a program similar to this be beneficial in Lethbridge?
I think that there's interesting social housing examples kind of across the world, examples that have both worked very well, and some examples like we see in places like the States that maybe have not worked as well. I think implementing such a strategy on a municipal level would be extremely challenging. I think that part of the reason there might be some success in some of the European countries is that overall buy-in, and also the tax base to be able to do that, right? Under the current funding models and under, I know I can speak for myself, under what we could offer as an organization, there's no way that we can move towards that. Sorry guys, I'm a little sick, move towards that model. I think that it's interesting to look at. I can't necessarily speak to it though.
Okay, somebody else was also wondering, these moms would benefit from 24/7 support to have success. Many have trauma, addictions, and mental health, as well as little parenting knowledge. Are there plans to expand on this population?
Well, if I could get some funding, I've got some ideas. Because actually that is a gap, and it is couples also. Like often the supports that we have are for people that are single, and it's tough to support couples. So families, couples, people with dependents, it is a big gap. I think in everywhere, it's just in general. So yeah.
There is an argument to be made, also looking at individuals who are being served, by looking at who are the individuals who are the most chronic or highest users of the systems. If we're targeting them first, knowing that there's a finite amount of resources, and not saying that they're individuals who deserve to be helped above anyone else, that's not at all the message, but saying if there's these individuals that are very difficult to serve and they're the highest cost individuals to leave kind of floating in the system, if we design a system that can serve that population effectively, and we meet their needs, that money or those resources can then flow back into the system. And you've also designed a system that works for the most complex. So you already have those structures in place to expand. I think everyone in our community recognizes that there's needs beyond that which we're able to serve. Part of the reason why they've started this model of creating a consortium of different members working in permanent supportive housing is that we can most effectively use our resources or share our resources in such a way that we'll be able to serve more people and expand. I know that serving women is something that we've absolutely looked at expanding and have continued to pursue funding, whether that be through grants or through partnerships. So hopefully we'll be doing that sooner rather than later.
And one nice thing is, I don't know if we explained it necessarily, but the YWCA and River House and SASHA's Versa program are all in a consortium. So we're able to, like, for example, people, if they go, we had just this happen already and we've only been going a couple months, but someone went to Hestia, which is a YWCA program. They realized that that person may have had some undiagnosed mental illness. And so we were able to say, okay, well, bring them over to Versa. We have a little bit more, not necessarily expertise, but just a little more, maybe ability to connect and a little bit more experience. Our staff have a little more experience working with someone that is having some symptoms of mental illness. And so we're able to really kind of move through our programs. And so it would be great to have more people in a consortium, then we would be able to kind of specialize our services a little bit.
I was just going to ask if you could talk more about the consortium. I know a lot of people are really interested in that.
Yeah.
So somebody else was wondering, is there sort of a document or graphic that shows the continuum of housing options that can be used sort of to educate people?
Kale has a lovely one.
Oh.
I do, yeah. We'll be releasing, in terms of permanent supportive housing, we're going to be releasing some information to the community, including kind of a systems map. But it goes beyond permanent supportive housing. So I would say services range all the way from things like rent subsidies offered from Lethbridge Housing to 24-hour intensive live-in supports. So we do have a range of services, but within that range of services, there's definitely some gaps, right? As Sharon mentioned, couples, as Joanna had asked about those single moms. So that it's going to continue, but there is a range, a wide range kind of across our city.
Somebody else was wondering, do individuals on AISH qualify for rent subsidy if they have other overlapping concerns?
Absolutely, they would qualify for the provincial subsidies, and kind of a benefit with AISH applicants as well. The province has deemed that the last number of AISH increases don't count as income. So when we are doing the scoring for people who are on AISH, we are only looking at the first $950 of their AISH income. Of course, if they have additional sources like CPP, disability, or if they're working, then that kind of changes. But if they are on straight AISH, we are looking at less of their income than the total amount that they're receiving.
Okay. Somebody else was wondering, with the current economic climate caused by the pandemic, has social housing become even more important in our community?
Absolutely. Actually, just in February, we worked alongside the city to release a brand new subsidy program, and it is for people who have financial impacts based on COVID. It is the first program that is open to renters as well as homeowners for people who are being impacted. We have so far had 83 applications in the 6 to 8 weeks, I think, that we've been operating the program. And the state of the applications that we're getting is quite intense. There's significant utility arrears. There's significant debts that have been incurred. People trying to survive on the $2,000 a month of the CERB or CRB is not what they're used to, and so it's been quite difficult to keep up with bills and things like that. We've seen city utility bills that are close to $4,000 in arrears. It is just awful right now. So I do believe that programs that support people who are on fixed and lower incomes are as important as ever. But it's also important to work on preventative programs as well, like this fund is for, to keep people in housing, because the pandemic will hopefully one day end. And so if we can keep people where they are, then once they get back into the workforce and they get back into their normal routines, I think we could see a lesser impact of that overall.
Okay, we had somebody ask what supports are available for youth.
So there's quite a few supports available in our community for youth. In the permanent supportive housing world, that would definitely be the YWCA's Hestia program. Then multiple programs. I know that at Family Ties Association, who hosts River House, we have multiple programs focused on children and family, obviously youth and family, particularly those transitioning out of services like children's services. Youth hasn't necessarily been, when we look at the homeless population in Lethbridge, we have some great programs working preventatively with youth. So I think that might be what we can attribute some of the lower numbers of young persons we see in our shelter system. But it hasn't been the highest needs population at this time. And like I said, thanks to the organizations that do great work within our community.
So Heather was wondering, what can SHENLA or other community groups do to advocate or support these and more projects?
I think the discussions, I know even within my own peer group, there's a lot of misconceptions or NIMBYism or judgments. And I think honestly, even within that group, advocating to your people and your circles, and really humanizing struggle across the board. A lot of times we have a lot of compassion for causes like single moms or for youth. The aging man that you see on the street may not get that same level of compassion. I think my big message is that a lot of the individuals you see there have things like disability, but they may not be visible. A lot of the individuals in our program are diagnosed with FASD, and they have an IQ comparable to individuals who may have a more visible disability, something like Down syndrome. Recognizing that as a community, if we're able to serve our most vulnerable, there's positive impacts for all of us. I know that some of my most outspoken people in my life are against social housing, are also the most outspoken, complaining that there's individuals they see downtown or doing these different things, and recognizing that if we can support that population as a community, we can get back to where we want to be.
How do we overcome that notion though of like not in my neighborhood? Because that seems to be like the biggest, I find, I mean, this happens in places other than Lethbridge, right? Like nobody wants it in their neighborhood, but I mean, where else does it go, right?
Yeah. You know, one thing that we had some neighbor kind of situations, and I just said to them, like, just go next time that the person's there, and if they're just a minor little complaint, and I just said, next time they're there, just go talk. Like they would call us and say, well, this person's doing this and it's really bothering me. Can you do something about it? I said, well, like, this is like this person, he may look a little, maybe he looks a little different, or maybe that somebody that you might be scared of. I said, honestly, he's like the most lovely man. Just go have a conversation with him and ask him to stop doing whatever it was he was doing. So they did, and they went and had a conversation, and they're like buddies now. Like, and I think things like that, like go have a conversation, talk like the people that we support. Maybe the way they look is a little bit like you wouldn't necessarily be somebody that you would be like, oh, that's my like best friend, but they're like hilarious. They're lovely, lovely people who happen to maybe have a mental illness or use a substance. So I think that if we can do things that would get to know them, like that's really what it boils down to. They're just people who may have some differences.
I also, for me, I believe that it's really beneficial, and understandably, like when people are operating out of NIMBYism, typically I feel it's driven by fear of the unknown.
Mm-hmm.
I think reaching out to service providers, particularly those who might be operating in your communities, and talking to them. If you're coming to a service provider, particularly with legitimate concerns, not necessarily emotion, I would love to talk through what we could do. Right? I think sometimes on the spectrum, even within social services, we can get defensive and almost be right fighting in some ways, and then sometimes the discussion really gets focused on the really strong dissenters, the people most against it, and against the agency trying to argue anything they say. I think there's a lot of room for reasonability in the middle. I think that there's a lot of times where we can say, hey, what is that concern? Let's try this strategy to see if we can address that. Let's plan on meeting a month from now and see if it's having a positive impact. I think that sometimes we allow ourselves to get too far before having those discussions, where if we're just having them on the front end, we can have a lot of reasonability and work in a way that works together. I think the other big thing to recognize is that social service programs, I know we're a nonprofit. Not many people are in this for the money. We're there because we're trying to, we're really trying to make a positive impact. We're not trying to, we want communities to be better. So working alongside us, I think, is a great way to get what everyone wants addressed. And I know that when we started River House, we were meeting with our community every quarter, talking about concerns, and sometimes a really simple change can make a big difference. One of the changes that was asked of us was we were using the back deck for our population to socialize, because we thought that might be less visible or less of an eyesore, not my word, for the community. And one of the things that the community brought forward was that was increasing traffic in the alleys, which made them uncomfortable. Very simple solution. We can switch that around. We can talk to our residents. We can make that happen. So again, just that communication with the service providers, and let's be reasonable. Let's find solutions that work for everyone.
That's great. Somebody was wondering, do you see this as more of a social issue that can be addressed only on the municipal level, or are there roles for other levels of government?
I think absolutely every level of government has a role to play, and I actually think that they are playing a role. Could there be better coordination between all systems? Yes, in any world that's the case. I know that the federal government has a Reaching Home initiative. I know that the province aligns through things like the 7 Cities Coalition. And then I know at a municipal level, we have a long history of partnership between organizations. And then now some of those partnerships have been formalized, such as the coalition. So I think that all levels can work together. I think that the more clear we are as a community and united as a community, the better we stand to advocate. We are not one of the large centers necessarily, that we're not in Edmonton or a Calgary, but working together effectively and demonstrating that we can be effective, I think, is a great starting point to advocate to those larger government levels.
So Sharon was wondering, how do we work with businesses, communities to address some of the concerns they have about negative impacts on their businesses?
I think that it's just the same kind of thing, and recognizing that the programs that we have are, like I was saying kind of before, they are the preventative things. They are supporting these kind of programs are the things that are going to make it so that, you know, there isn't an impact on your business and you're not seeing the negative kind of things that sometimes are associated with individuals who are homeless. So I think that if we can just work together and continue in these kind of programs, it will make a difference. It may not be an immediate difference, but it will make a difference eventually.
Somebody else wants to know what the best case scenario is over the next 5 years.
That's a good question.
In regards to what? Best case?
Yeah.
Sorry.
I think just like in the community, like what would be the best case scenario for Lethbridge? Like what, I guess maybe part of that is what the need is and what our best case scenario could be in 5 years for that.
I think that we've started now with some of the community planning. Best case scenario, I can speak for our organization, would be to really make clear pathways between all of the different kind of social service serving groups and different government bodies, eliminating some of the difficulty that we face communicating between us, health, housing, funders. And if we're able to kind of eliminate some of that and really be able to offer things quickly and efficiently, like treatment, like housing, I think that that would have the biggest impact for our community. If we can get rid of some of these wait lists and really serve people, I think that that will have a huge impact on not only the appearance of the community, because these individuals will be connected, but also on kind of the overall community well-being. I think that people thrive when they have purpose. I don't think that many people desire to live homeless in the shelter or have these challenges, but I do think that right now many of our systems are quite difficult to navigate. I know that we have a very competent team made up of nurses and social workers, and there are times where navigating things like detox treatment, all of the different pieces that come in could be a significant challenge. I know that even when it comes to things like applying for different types of funding like ASH, that we run into barriers as a professional team. So if we can, as systems, work better together, that would be my best case scenario, because that would allow that front end user, the individual who's struggling, to navigate them and get the help or support that they need.
And I think too, to add to that, when we can see, like I said, we have people, I think we've only really had like 30 days total, like of the average of people that have been staying with us. And I can't even believe the amount of difference that we're seeing in their lives and the amount of difference that the community as a result is seeing. I think that if we can, help people navigate these systems and get the right supports that they need, we would see a huge difference. I know that we're as an organization, we're helping with the point in time count. And I was looking at last year, and I think there was 230, I don't know exactly, 234, 233 or something, last year. And I would like to see, like, when we do that this year, what it is, and just to see a reduction in that would be amazing. If every time we did that, it was reduced significantly, would be great.
I also, when we're looking at what a 5-year ideal would be, there are communities in Canada that are doing very, very well at trending towards functional zero for homelessness, meaning that when somebody enters their shelter system within a set period of time, whether it be 35 days or 45 days or 30 days or 45 days, that individual is placed in some form of housing. I do not believe that homelessness is an unsolvable problem.
Yeah.
I believe that we can absolutely achieve a functional zero if we commit to it. So in my world, that would be the ideal.
Yeah.
Yeah.
And I really, really think it's possible. Honestly, I think we could do it.
Somebody was wondering, what are the biggest risks you see for social housing programs?
I'm not entirely sure what, like, I don't know, Kale or Sharon, I don't know if you guys have any kind of input there. I'm not entirely sure what the risks would be for on our end.
I think for me, one of the biggest risks would be the economic landscape that we're in right now. Recognizing that moving forward, we're definitely going to be operating deficits all across the board. If anything, I think that it's important to recognize that during those times, that's when social housing is the most important, right? So making sure that we're advocating together, saying, listen, we need to take care of our most vulnerable. But recognizing that as anytime there's economic landscapes that shift, particular deficits, oftentimes that gets politicized and becomes a platform item. So anytime there's change in governments or deficits, I get a little bit nervous. However, I think, again, just continue to advocate that it's during trying times, that's when these social supports are most needed.
Yeah, that's when it's needed the most. Yeah.
And I think there's a lot of opportunity building off of that to look at different models for how these things are offered to try to appease different funders and funding sources. One of the things that's been very successful in Edmonton is a mixed market model for housing. And so in Lethbridge, we do pure social housing. So we have a high rise, it has 142 units. Everybody in there is paying based off of 30% of their monthly income. One of the things that they do in Edmonton is a mixed model. So some people in there will be paying that 30%, while other people would be paying the affordable rate of the 90%, and other people would be paying a pure market amount. It creates a cohesive community, and then it allows for a little bit more income coming in from things like that. So there's a lot of creative opportunities out there to try to make things like this work in a tougher economic landscape.
Mm-hmm.
So kind of going off that, somebody wants to know, what are some of the biggest challenges that you've had in relation to COVID-19 for the population you're serving?
For us, one of the big, oh, sorry, go ahead.
No, go for it, Kale.
Okay, for us, one of the biggest challenges that we've had is the restrictions that are in place to keep us and the community safe. Recognizing that, so River House in particular is licensed under supportive living and accommodations, which is similar to like what you'd see in an old folks home. Our population doesn't do super well locked down with limited activity. Another challenge we saw was initially when the pandemic started, many of the external supports that we were bringing in were no longer able to come in. So we would have things like home care, and we weren't sure how that was going to work at first. So our workers were stepping in and they were acting as a disability support, providing services that they wouldn't otherwise do, like incontinence services, bathing, really having to step in to that. The other thing that we ran into that was definitely a challenge was because we're licensed under health, but we operate somewhat as a shelter. We had to follow both sets of regulations. One of those regulations was that if any of our individuals got sick, we were expected to provide care in place. So we would have to care for them on site. So definitely some very rapid onboarding. The other main challenge that I'm thankful to public health in the province for was very limited PPE. So finding any gloves other than a size extra small was near impossible for us for a while, but the government did come through. I also want to do a shout out to our community, looking at our community service providers. They got together and created, in partnership with the city, kind of a media group where we could share resources. And that was fantastic. I know that we did some equipment swap with LSCO where we had some extra stuff, they had extra masks. So really as a community, it was kind of cool to see everyone come together and share those resources. But there was definitely that, oh crap moment. We had enough supplies for what would typically happen. We didn't have enough supplies on site to have every individual potentially go down sick, right? So.
Yeah, and I would just echo that. We had the exact same challenges. We had an outbreak, and PPE was a challenge. But the biggest challenge for our population is just that the mental health supports that we were able to access are really a lot tougher when you have to do them like through Zoom or online, or when people were going to groups. Typically, most of our folks didn't normally spend much time during the day. They wouldn't really be there. They would be at, the Schizophrenia Society, they would be at the day treatment. So that really affected our people, but we were able to get some grants. So we were able to bring in some extra staff so we could provide more recreation and more group activity on site, so that it worked out okay. And I'm glad there's a little bit of, everybody got vaccinated in our site this week. So hopefully we'll get back to normal a little bit.
Yeah, for us, the isolation of our tenants has been the biggest struggle. Because we are independent living, we weren't allowed to continue providing any kind of the on-site recreation that we were able to do before. So all of our groups were having to end because it was all just recreation socialization. It wasn't any kind of mental health support group or anything like that. So I know a lot of our seniors are feeling very isolated. We have been accessing things like the Keep in Touch program and a lot of the virtual programs. The tablets with the library has been phenomenal, but there's still a lot of people who are feeling very isolated right now.
Okay, so we have just a couple minutes left. So before we go, I just wondered if each of you could sort of tell us maybe one thing that you really want people to know or be aware of, just so that they can take that out and, spread that with their organizations or just in the community about social and supportive housing in our community.
My one thing would be recognizing that a lot of these individuals who may seem aggressive on the front side, once they're in a supportive, safe environment, a lot of that goes away. The culture of homelessness, the aggressor on the street is less likely to be targeted or victimized. What we see is a really cool group of individuals who are actually quite protective of staff, quite protective of our neighbors. So given the opportunity, a lot of these individuals can do quite well, despite their multiple challenges, whether it be mental illness or developmental disability. So I think that everyone deserves a home, and we can do better as a community. So that's my message.
Yeah, and I think I would just echo that, honestly. I think that these are our neighbors, and we just need to get to know them.
I think I echo all of what was said there as well. I would just like to see the opportunity for some of these bigger projects to serve more of our community, to just have a chance. I know NIMBYism is a hard thing to battle, but I think if some of these agencies were given an opportunity, you would be very surprised at the good that could come from the work that's being done.
Well, thank you all so much for joining us tonight and sharing with SHENLA and the library's patrons and the community about social and supportive housing in our community, because it's something that I think a lot of people need to learn more about and just understand more. So this really, I think, helped people understand more. And if people want, in the chat, there's a couple emails to reach people. And again, thank you so much for joining us tonight. I really appreciate it.
Thank you.
Thank you.